Well, this group has a long track record and expertise in the use of what we call oncolytic viruses. These are cancer-killing viruses that are able to selectively target and kill cancer cells whilst leaving the normal body's healthy cells alone. You not only get a direct killing effect of cancer cells by the virus, but it also activates the patient's immune system. And it's this activation of the immune system that allows much more durable and powerful responses against the cancer. We are trialling a fairly new virus, Coxsackie A21, which is actually a strain of the common cold virus. And we're using this in a phase 1 study to treat patients with superficial bladder cancer. And so far the results of this have been very exciting in that we've been able to see infection of the tumour by the virus. We've seen inflammation of the tumour, and even in one patient we had a complete response, i.e. the patient's tumour completely disappeared. Well, although obviously conventional treatments have their place still in cancer treatment, everyone knows the horrible side effects that are associated with chemotherapy, which are highly toxic drugs that unfortunately don't just target the cancer cells but also target healthy cells at the same time. There's a real need to develop much more targeted and less toxic treatments for cancer patients. And it kind of makes sense to use the body's most powerful defense mechanism, the immune system, to do that. Drugs have now been developed, immunotherapy drugs, which allow us to release the brake that's put on the immune system by the tumour, allowing the immune system to do its job to actually kill the cancer cells. And this has already been seen to have remarkable effects in cancer patients and has really revolutionised now the treatment of particular types of cancer. The oncology team is based in a building that's literally just across the road from the Royal Surrey County Hospital, and we routinely receive fresh tumour tissue direct from theatre, so we can have that into the lab within 30 minutes of it being removed from a patient. Yes, we received funding for this, what's called a vibratome, from Topic of Cancer, and it's really changed the way that we can do research in the lab. Much more accurate model system of being able to test our agents on tumour tissue, and is much more representative of how these agents might work actually inside a patient as well. Money raised through Topic of Cancer has enabled us to buy essential pieces of equipment, which is allowing us to do research that we were unable to do before. They also support the salaries of our research staff. So it's extremely important to have this hugely beneficial link with Topic of Cancer to support the work that we do.